history of sexually transmitted diseases goes back to when there have been people.
Syphilis and gonorrhea were some of the earlier STDs.
In 1494, syphilis became an epidemic in Europe, killing over 5 million people. Gonorrhea is recorded as early as the 1300s in Paris, France, where prostitutes were known to be found. In the early 1900s, salvarsan and antibiotics were discovered to cure several STDs. In the 80s, herpes came on the scene.
HIV, it became a pandemic, in the late 80s, early 90s. There's a handful that have been around forever, but over time, with better laboratory testing and better ability to find them, and as we evolve, there have been new ones thrown in the mix. The history of the name, it comes from the time of the ancient Greeks. They believed that these were diseases of the blood, thus they were called venereal diseases or venereum.
And then it changed over to sexually transmitted disease. Once they started understanding where they came from and how they were transmitted, that's where that came about. And then people started feeling discriminated or isolated by the word disease. STDs, as they used to call them, are now known as STIs.
People are not taking the bait, so we're going back to STD. It took me probably a couple years to get on the STI bandwagon for them to now switch it back. So we have to go back to what is commonly understood.
There are many different STDs. Some of the most common are chlamydia, gonorrhea, syphilis, Hep B and C, herpes, HPV, HIV, which can turn into AIDS, trichomoniasis, pubic lice or crabs, and scabies.
Sex can be oral sex, anal sex, or vaginal sex. And that's how an STI or STD is transmitted, through anything that ends in the word sex.
Some sexually transmitted diseases can be transmitted through the mouth, typically oral sex. Herpes is an example of that. Human papillomavirus is an example of that. They can be transmitted through mouth. Syphilis can be transmitted through oral sex. Gonorrhea can be transmitted through oral sex to the back of the throat.
Chlamydia can also be transmitted through oral sex to the back of the throat.
You can also get it from rubbing against each other, your genitals or in parts of the body, such as herpes. If there's a shedding a virus or a visible lesion, that can be transmitted, especially in the mucous membrane areas down in the genitals. Sharing of sex toys is another way that people can transmit STDs. You could get gonorrhea that way. You could get syphilis that way.
Any place on your body that has mucous membranes has the potential for getting these infections in it. So we're talking eyes, nose, mouth, genitals, and rectum.
You can also get it through any kind of blood-to-blood contact. You need a point of exit and a point of entry.
People are at risk who have had tattoos. I always tell them that if they have been tattooed, did they watch the needle come out of a sterile container? I ask that routinely. If they're certain, I may still choose to do a hepatitis panel and an HIV test.
Hepatitis B and hepatitis C are viruses that are hardy in the environment, and they can live on needles for minutes to hours, and they can be transmitted through tattoos.
You can get hepatitis C from a tattoo or a body piercing. The key things there are to make sure that you're in a licensed shop. Most licensed shops do adhere to all of the protocol.
They can also be transmitted from maternal to fetal transmission in certain situations and with certain infections.
One of the myths is that it doesn't relate to me. I'm healthy and I don't need to worry about it. The truth is that anybody who is sexually active is potentially at risk because they've been exposed to body fluids of another person.
13 to 24 is always our highest population with new infections each year. That goes for every STD. The next age group would be the 24 to 35 group. They're the next highest, and that's always been consistent.
Most people think that STDs are only concerning young people, and that's also not true, because what we've seen is that older communities, especially retirement homes, also have issues with STD spreading.
We've seen an uptick in HIV positive and STI rates in senior citizens as well, because you have this whole generation who were raised, A, we don't talk about sex, but B, well, you just have to worry about pregnancy. No, we have to worry about more than just pregnancy. So these senior citizens are also not using protection because they figure they can't get pregnant.
I was working in a hospital with a woman who was in her 90s, and I was talking to her about safe sex practices and the importance of using a condom with her partner at the time. And somebody overheard the conversation, one of the other doctors, who said, "You don't really need to talk to her about safe sex. She's 90. Why do we care about this? She's not having sex." And there's an assumption that older adults no longer are having sex. And that's really detrimental to older adult health.
A lot of people think that the only time herpes can be transmitted is during breakouts. That is not entirely the case, because something that happens with herpes is called viral shedding. Viral shedding occurs when there is way more virus in the bloodstream, and the virus is literally sloughing off of the skin. And that typically happens and starts to occur several days before a breakout actually occurs. Unfortunately, it's not something that is seen with the naked eye. So an individual who is infected with herpes won't know that that's occurring. And so they could potentially transmit.
A myth is about HIV testing and the length of time it takes to convert to be positive. With current technology, they have something called fourth generation testing, where within days they could test for presence of the virus, and within a couple weeks they can also detect antibodies to HIV.
If you douche with Coca-Cola, you can flush out anything, and this way you don't get an STD, but that's not a way to not get an STD.
STD symptoms can include fatigue, vomiting, sore throat, diarrhea, nausea, fever, head or muscle aches, dark urine, painful or burning urination, pain in back, legs, abdomen, or buttocks, mouth or lip sores, irregular periods, bleeding between periods, pain or bleeding during sex, blisters, bumps, or sores in the genital or anal area, genital itching, burning, pain, or discharge, anal itching, bleeding, soreness, or discharge, swollen or painful testicles, lice in pubic hair, warts on thighs, pubic or anal area, or spots in underwear.
Sometimes people don't have symptoms and they have an STD that they're not aware of that can cause complications later on.
Some people don't know they have an STI because everybody thinks they're symptoms. Or the symptoms might get brushed off as, oh, this is a cold, or this is a fever, or this is something else.
Everyone should be tested for sexually transmitted diseases.
I have married couples, one member of a married couple come in who will tell me they've had a non-marital intimate relationship and want to be tested. So they're married, but they have strayed.
Anytime you enter a new relationship, you want to get tested. Anytime you feel kind of suspicious, you have some kind of symptoms that you're not sure about, get tested. Or if you work in the medical field, anytime you're exposed to blood or any other bodily fluid that can carry an STI or HIV, you want to get tested.
A person should know their status is because you can't fix something you don't know is broken. And if you go too long without treatment, you could have serious health consequences.
It is important for someone to know their sexually transmitted disease status for a number of reasons. Number one, to make sure that they get themselves properly treated for the infection, because some of them can have permanent sequelae or outcomes. Like syphilis, if you don't get it treated, it can actually kill you down the road, about maybe 20, 25 years down the road. The other reason that you need to know your status so that you don't transmit infection to others. It's very important that you don't transmit it to female partners who don't know, because if they were to get pregnant, they could also transmit it to their baby, which could have a negative outcome on the pregnancy or a negative outcome on the baby eventually.
It is important to know your status because some conditions can go hidden in your system and you don't even know that you have something until, especially for young females, 5-10 years down the road, you're trying to have children and they tell you, oh, you had this one condition and you didn't, it just reigned in your body and you didn't do anything. So because of not getting tested, you just didn't catch it in time.
Specifically for HIV, what we know is that when a person is diagnosed early enough, we can treat them early enough, and it's much easier to maintain and keep an immune system healthy than it is for someone to get sick, destroy their immune system, and we have to rebuild it.
You can live a very, very long, healthy life with HIV. If you don't get tested, you compromise your immune system, you can get sick faster. We actually just had somebody recently who was tested with us, and they got their viral load count back. We knew that they had told us it was a new infection. We thought it was a new infection. When we got their white blood cell count back, it was in the double digits, which means that they already have an AIDS diagnosis. So they were not just diagnosed with HIV with us, they were diagnosed with AIDS. Had this person been tested a while ago or had been regularly tested, they would have been able to catch the infection.
It's also important to be tested for STDs because if some STDs are left untreated, they can also cause blindness, deafness, dementia, paralysis, behavior changes, difficulty moving, liver damage, heart problems, strokes, meningitis, and cancer.
In the last couple of years, OraQuick has started selling over-the-counter OraQuick tests. They are the exact same test that we've used for years in our agencies.
This at-home test is a good alternative if you're in a new relationship or if you want to know your status or you want to know your partner's status. This is an easy way to just go into your local pharmacy, get the kit, test yourself or your partner, and know the results within 20 minutes.
For additional privacy and convenience, STD test kits can be bought online to test for a single STD or a variety of the most common STDs all in one kit. They usually consist of a finger stick, oral swab, or a urine test. Once you mail it into the lab, results are generally posted on the online platform.
We need as a society to pull together and start normalizing that conversation.
You don't want to be just wrestling around in the dark and then next thing you know you got an STI.
The best way to do it is to just rip it off like a Band-Aid.
When you're having a conversation with your partner, it can be difficult, but it is necessary. And what I would do as a partner, I would sit that person down and ask them, have you been tested? I've been tested. Tell them my results and then ask them for their results. And if they don't have it, let's go together. So that way you can feel comfortable getting tested.
I will say that from my profession, I'm a little jaded that I believe that when it comes to sex, people don't tell the truth. So I would suggest that you ask your partner if you're considering being really serious about having sex and making sure that it's safe, is to both of you go and get tested for the STDs together, and then you'll know at that moment.
I always tell people, make it a date. Come in, get tested, go out for lunch.
Some people are literally saying that they would rather not ask than having to deal with the awkward conversation.
Wright and her team created the Sure Web application where users can upload their negative STD results from a healthcare professional and show potential partners. This can be used to make the conversation easier by asking, "Are you sure of your status?"
If you do test positive for HIV or any other STI, there is a treatment. So it's not the end. Don't think it's the end. It's not the end of the world.
You have to make sure that you do whatever you need to get into care and to talk to a health professional. A lot of these diseases are either completely curable or can be well controlled. It's really important that you talk to people that you could have potentially exposed as well. The health department helps here. The health department encourages you to make a list of the people you may have been in contact with, especially in the last 90 days, and encourages you to talk to them directly.
The health department will also send STD investigators to notify people that they may have been infected with certain reportable STDs.
If you have a bacterial infection, those can be cured or eradicated from your body with an antibiotic because it's a bacteria and the antibiotic directly attacks the bacteria.
Parasitic STDs like trichomoniasis, crabs, and scabies also have cures.
Fortunately for us, we have recently discovered a way to cure hepatitis C.
There is no cure for the hepatitis B virus, but it can be treated with antiviral medications to slow the infection. Sometimes Hep B goes away on its own. There is a vaccination to prevent infection. There are several other STDs for which scientists have not discovered a cure yet, which include HPV, herpes, and HIV. However, HPV does have a vaccine.
We try to push the vaccine, which is between the ages of 11 and 26, a series of 3 shots, both male and female now, so that they never have to deal with that.
HPV can actually be shed by the body. We're finding that especially young women have the ability, because the cervix is growing and evolving, they have the ability to shed the old cells from the cervix. And sometimes when they shed those old cells, they shed the HPV and it actually goes away. So sometimes the body takes over and says, okay, we're going to get rid of this.
Although there is currently no medical cure for herpes, medication is available to suppress outbreaks and lessen the chance of transmission to a partner.
HIV is also an incurable infection. And with HIV, a person has to get on treatment. They have to start a regimen of what we call a cocktail. The cocktails are combination therapies. So you take more than one medication. They have been able now to put more than one medication in one pill.
When I started in the field 15 years ago, people were taking 10, 12, 15 pills a day. And now we're down to several. We have several single tablet regimens where there's several medications in one pill that people take once a day, sort of like a vitamin. So it's very manageable, and the medications are a lot less toxic than they used to be and have fewer side effects.
There's other ways we have to prevent transmission of HIV, specifically PrEP, by which we mean pre-exposure prophylaxis or pre-exposure prevention, which is being on a pill every day, taking a pill every day called Truvada that helps to decrease the risk of transmission of HIV.
PrEP is if you know that you're with somebody who is HIV positive, or you're not asking people their status and they could be HIV positive, PrEP is a really great way to go because it'll keep you protected from HIV beforehand.
PEP, post-exposure prophylaxis, is given to those people that have a possible exposure to HIV.
As a 19-year-old woman, I was diagnosed with HIV. I was in a 5-year relationship with one person. And for me, I did not believe that HIV would attack my life or come into my life at all, because I personally was not doing anything that would put me at risk. Didn't realize I was having sex and it was unprotected. Period. Full stop.
I'm a big advocate for condoms, and if you didn't catch that, condoms, because condoms will protect you against STDs, including HIV.
The condom is protecting just basically your head and your shaft, and that's it. You know, it's not protecting everything else. You can still catch genital warts on your other areas.
Certain diseases like HPV or herpes simplex can certainly be transmitted through the skin contact where the condom doesn't go on, if there are active lesions there or if there's virus shedding.
Latex condoms are the preferred condom for the prevention of sexually transmitted infections. Natural skin condoms allow for greater sensation, prevent pregnancy because of the size of the sperm, but do not prevent against virally transmitted STIs because natural skin condoms are made of lamb's intestine, and the virus can pass directly through that.
Lubricant's really important with condom use, especially when we're talking about latex condoms, because it actually reduces the friction and reduces the risk of it breaking.
There is also female condoms that can be used. So if the male does not want to wear condoms, a woman can take methods to protect herself.
Female condoms are made out of polyurethane, not latex. They're not stretchy, but they kind of cover a wider surface area of the vaginal mucosa than a male condom would.
For an older adult, a female condom may be more comfortable for intercourse because of vaginal dryness. Using a typical male condom can be a little bit uncomfortable.
Dental dams come in various flavors and sizes. They're used to cover a vagina or an anus for oral sex. If you can't get your hands on a dental dam, use saran wrap. The beauty of saran wrap is actually multi-layered. Saran wrap is great because you can use a much bigger piece.
Finger condoms are another form of protecting yourself. You can use that when you're fingering somebody. This protects if you have a cut on your finger, and you can prevent yourself from getting something.
The big ways of protecting yourself against a sexually transmitted disease, one is to limit your sexual activity.
Abstinence, of course, is the only foolproof method for not getting a sexually transmitted disease.
We often find our patients wondering, why me? Why did I get this infection? Why did I get HIV? And it is a struggle over time. The initial response might be denial, I don't have it, or I'm not going to die from it, even if I don't take care of myself. Or it may be anger, and they may be angry at the world, they may be angry at themselves.
When a person is diagnosed with an incurable STI, some of the feelings that they go through and some of the thoughts that they go through is the feelings of fear, maybe suicidal ideations, maybe depression, maybe just scared of the unknown, the expectation that they don't know what is going to happen day by day. So getting the support that they need and getting that at that moment is so critical.
It is recommended that in order to help deal with the psychosocial aspects that you would go to therapy, maybe talk to someone like a social worker about how you're feeling and how to deal with that. If you're ever feeling very depressed or suicidal as a result of one of these diagnoses, it's important to talk to someone. The emergency room is always available, calling 911, and if it's not an emergency, talking to a therapist.
I remember not having any support. I did talk to my family at the very beginning. I told them my status, and my mother, in all of my years, I had never seen my mother cry until that day. And I am her only daughter. So that made sense to me. But after her initial, shock and hurt and disappointment, the next thing that came was talking to me about washing my clothes separately and getting me plastic silverware for the house and paper products. And by that time I had already had children, and I was told not to kiss my children for fear that I would infect them.
There are a number of support groups available, especially in major cities, for people living with incurable STDs.
I had to get to a place of personal acceptance, accept responsibility for the part that I played versus blaming someone else. And then I took the reins of learning, educating myself, and educating those around me.
So there's stigma just around having sex and having sex with people you're not married to. So the stigma starts there, and then you went and you added insult to injury by getting an STD. Well, then if you add insult to injury and you get an STD that's uncurable, it's like these levels,
You're nasty, you are promiscuous.
The broader society blames you if you get an STD because you weren't abstinent or you weren't monogamous. It's almost like a scarlet letter that you wear.
I felt like walking around in my own skin, that I was branded and people could see HIV on me, even though if I look in a mirror, there's nothing physically visible. But I just felt like that scarlet letter of HIV all over me.
Folks with herpes have a huge stigma. And you hear it, when we talk about stigma, people often miss where we do have this stigma, right? Where do you find stigma? How do you identify stigma in your community? It's in the jokes. So especially young people, I worked a lot with teenagers especially, you'll hear them say, oh, what's that on your lip? Oh, you got herpes?
People tend to shy away from folks that have picked up an STD.
I've seen people lose their jobs because their bosses find out that they have HIV.
Discrimination does exist for people who have STIs, such as incurable STIs, HIV for instance. They're pushed aside. they're marginalized and they don't get the same respect that other people who may have contracted something else throughout their life.
Every single one of us walk amongst people who are dealing with STIs that are curable and non-curable every single day, whether we are aware of that or not. And the moment we choose to be intimate, we choose to do any kind of activity that puts us at risk, whether we believe we're at risk or not, we are.
People stay where they're comfortable. So in particularly specific populations and pockets of folks, they tend to culturally stay within who they know, who they've grown up with, what's familiar to them. So it's very easy for there to be a certain level of trust in knowing those people and not believing that they need to use protection, not believing that they need to ask questions. Oh, I've known Sally Sue for, 100 years. I don't need to ask her about whether or not she's HIV positive. She would have told me. I don't need to ask if she has herpes. She would have told me. Yeah, not necessarily. And most people don't take that into consideration.
STIs are increasing across the country and across the world. And one of the reasons is that sex is actually a stimulant. There's dopamine levels in that. And when you are in a relationship, it's a fun thing to do. It's exciting.
The other reason is that situations where alcohol is used, other recreational drugs are used, we may not be as careful about decreasing the risks to our own selves. And those situations are where sexually transmitted diseases can be more easily transmitted because we're not as careful about using a condom all the time or throughout the encounter.
The reason that sexually transmitted diseases are so rampant today is that that people are less afraid of HIV.
The age group that's at the highest risk did not live through the 80s HIV epidemic when it was brand new, watching people get sick and die, watching people with Kaposi sarcoma. We're not seeing that anymore. So there's no nervousness.
People don't have a perception that they're at risk. I think people think things can't happen to them. Particularly our young people think they're invincible. They have the Superman complex. Nothing can hurt me.
The other thing that's changed is the advent of communication, the way that people have sex-seeking behavior. The online medium of apps such as Tinder, they can use GPS location and know who's in the area and who is ready to have sex right at that moment.
We have plenty of people who are heterosexual men who are married, who are in committed relationships with opposite gendered partners, and then have sex with men on the side. We get plenty of them, which, no judgment, we don't care. We just want everybody to be safe.
In the beginnings of HIV, there was a lot of attention given to people with the disease, especially when treatments were given and there were support groups. For people who didn't have a sense of belonging or a place of belonging, some of them did something called bug chasing, where they would get HIV so they become part of this commonality or fraternity or sorority of people that have the disease, and you have somebody that can bond with over the infection.
A bug chaser is a person who is intentionally attempting to get infected with HIV. And one of the reasons that people do that is because of survivor's guilt. Some of them have been people that have seen their friends, their loved ones, all die in front of them because HIV was a terminal illness at that time. It wasn't chronic. And they feel like I'm the only one left.
Bug chasers are people who know someone has HIV or another infection and purposely try to get infected with that particular infection. I've seen it more in the HIV community because there's a whole lot of resources that people who are HIV positive have access to that other people don't.
The cocktail has been some bug chasers' motivation. While bug chasers are seeking to intentionally catch an STD from someone infected, others are intentionally spreading STDs to those who don't know they are infected, allegedly.
I think some people are fearful of being alone, so they would rather infect someone that they're with, thinking that that would precipitate them staying with them.
Some people might be afraid to admit it because they think that you won't have sex with them if you tell them that you have a certain disease.
I would think that people would knowingly spread STDs because they are angry that somebody gave an STD to them and didn't tell them.
They want to make someone pay for what happened to them.
They're living a reckless life.
When you talk to your doctor about your sexual health or any questions or concerns related to that, they will keep your information private and confidential. The only situation where they will share your information with the public health department or other authorities if they feel that you're knowingly being a threat to somebody else or knowingly passing on disease.
Knowingly spreading an incurable STD is against the law and is punishable in many states. Criminal penalties can include jail time, having to register on a sex offender list, fines, and restitution. Civil penalties can also occur.
The reason why people don't press charges for someone giving them a sexually transmitted disease is because of embarrassment. No one wants others to know what they have contracted.
Dating with an STI is very challenging because having to disclose that type of information to anyone, and most especially someone you are interested in sleeping with, is very hard, knowing that you could be rejected solely on that basis.
It's important to know that a diagnosis of a sexually transmitted infection does not mean that you can't continue to date. It's important to have open communication and find a partner that you feel comfortable talking to.
I was upfront from the very beginning and basically saying, before we even get to a place where you really, really like me and I really, really like you, let me tell you something about me that you need to know. I'm going to give you the choice that was denied me.
You don't want to be so afraid to lose a person by telling them an intimate secret like that, where you end up losing a relationship anyway because nobody wants to be with a liar. Nobody wants to be with somebody who's keeping secrets.
And you want your partner to know everything about you.
There's always this fear of, now they're going to look at me differently. There's always this fear of, oh shoot, they're going to now go and disclose my status to other people that I did not approve, knowing my status.
You want to wait until you know you can trust that partner.
The good news is there's this whole world out there on the internet of people looking for people. And so there are some positive dating apps for people who are HIV positive and websites.
They provide a place for people that have specific STIs to find like people to date. That kind of eliminates some of the stigma around having an STI and some of the anticipation or anxiety around disclosing an STI status to someone else, because they already know that everyone in that space has something.
For those who have an incurable STI, I pray that researchers and scientists will find a cure that will help them.
Nationally, 4 out of the 8 reportable communicable diseases are sexually transmitted diseases. Chlamydia is number 1 and gonorrhea is number 2. The problem is that it's going to take a village to intervene and reduce the numbers of the diseases. And we need doctors, we need parents, we need those affected to be part of the solution, which needs to be sex positive and not just about abstinence.
Churchgoers are having sex. I believe the church should talk about sex, especially because it's something that is forbidden in church. Pastors don't like to touch that subject.
Educators nationwide need to understand that young people need comprehensive sexual health education and that it needs to start young. We are not giving our kids credit. We are thinking that they're too naive or maybe they don't understand. We need to arm them to stay safe. If we don't, we're talking about adults who are going to have STDs as well.
Know your partner, be careful, and be smart.
In today's society, this is why we need to be so discerning about what we do with our bodies. We need to be protective over our bodies, and we need to be having those conversations with our partners about what their situation is in terms of their status.
Please, please know your status. Know your status. And always trust yourself. When you have that instinct That instinct in you for self-preservation is there for a reason. And if you are doubtful at all of a partner or partners that you may have, please be protected, always. Because HIV is preventable. Don't have to get it.
I just wanted to know what all the hype was about. I guess you could say I wanted to know how it felt. So I lie in position on the bed as he loosened his belt, climbed on top of me, and like the immature boy that he was, took care of his business. No thoughts of intimacy, no rub, no kiss, just slid inside of me. I mean, after all, what can I say? We were both teens. Unlike what we saw in the movies, no passion, no love. Just an experiment, I guess. A little pleasure for the moment. I did ask him to wear a glove, but he said he didn't want to. Said it would feel different. And against my better judgment, I didn't second guess it. 10 years, a kid and a husband later, I'm sitting at the doctor's office like, damn, what was I possibly thinking? All this time, just from that one time, it was my first time. He said it was his, but I think he lied. I mean, obviously he lied. But hey, like I said, I just wanted to know how it felt. I wanted to know what all the hype was about. And it wasn't even all that. I thought it would make me feel special, you know, like all warm inside and stuff. At that age, I didn't even know what an orgasm was. But now, come to think of it, man, he couldn't even get me that high. I wasn't really into sex for a while after that. I sat back, no need for another try. I'll just wait for the right time. I'll wait for the right one. And when we connect, it'll be on a more spiritual level. For better or worse, till death do us part. We'll become one before we become one. We'll make love all night and wake to the morning sun. God's favor be upon you, 'cause he who finds a wife finds a good thing. And I feel so blessed that I finally found my king. But damn, it sucks it could all be over in the morning. I have to find a way to tell him. So while he sleeps, I'll lie awake thinking. My whole life could be ruined from one stupid decision. Damn, I really wish I could turn back the hands of time. Surely I would have handled things different. But due to my immature way of thinking, my family may be at risk. Death could be staring them right in the face. If only I would have been patient. Why couldn't I just wait? Why couldn't I just wait for the right moment? When I would make love rather than sex. When I'd give him my heart rather than a temporary spot in my bed. Now all these thoughts running through my head. The day after I should have went and got a test. Not mature enough to realize a moment of pleasure could possibly cause me a lifetime full of pain. Now I suffer the consequence of one stupid decision. I pray he doesn't leave me and take the kids with him. They say it's no big deal, it's just sex. Well, if it's no big deal, don't be afraid, go take the test. Knowledge ignites the power we have inside to raise awareness and save another's life. I don't know how my story will end, but what I do know is that yours doesn't have to begin. Just stop, take a second to think. A sexually transmitted disease has no specific name. Don't let yourself fall victim to the game. Condom or not, it all feels the same. Be smart, use your brain, save the day, wrap it up and be safe.